All right, now we go into the second half of this presentation where we try as much as it's possible for a public demonstration of this kind to imitate the therapeutic situation. It is, of course, much easier both for the therapist and for the patient to be natural. They are alone in a room by yourself. But to do it here in front of a larger audience is a bit risky, and I hope it will work out all right, but one always has to take a little bit risk with a procedure like that. Now you see, two of our students here have been graciously consented to act as a kind of a guinea pigs, and you have to make allowance for the fact that it's not easy for somebody to be planted here suddenly on a podium with me and so to say to jump through the hoops, but we both shall try our best. So our first guinea pig or our first helper is Miss Tara Whitehill. And let's assume, Tara, now that you have come to my office and you have told me that you, for a while you had problems with your voice, that after talking for 15 minutes, 20 minutes, maybe you are a substitute teacher in the public school system and have suddenly faced strange classes with poor discipline, and your voice has been getting hoarse, more and more hoarse after prolonged use. You have seen by a laryngologist. In that case, I would be able to do it myself and have satisfied you that your vocal cords are in good shape. And as a starter of therapy, let's assume that you have already received from me that little introduction which I did at the wind-up of the whole thing. And I said, all right, now let's go to some practical use of it. And what I would tell you is just try to play a little game. Just imagine for a moment you sit there and you have something in your mouth. The air in your mouth is a piece of bread or meat. And you chew in a very loose movement of the jaw. And while you do that, make a little sound like a monotonous kind of a neutral kind of a hum. If I do it only, thank you very much. If I do that, it would very good, excellent. Now, if you do it once more, and after you have done it like this for a brief period of time, you do it with a wide open mouth. In other words, if I can demonstrate it first to you and then you try to imitate it, let's assume you forget all your manners and you speak with a full mouth. Yeah? You do exactly, you know, when you were young, I'm sure it must happen to you that you were sitting, eating your lunch and talking at the same time to your mother. And then she said, don't ever speak with a full mouth. Now I ask you to do just that. If I do that, yum, 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 first closed mouth. Now I have to tell you one thing, Tara, you are too good. You see, because you catch on at the first time. But it happens very often, you see, if a patient, you ask patients to do that. Very often they do first, yum, 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 yum. They just open and close their jaw. And then you have to ask them now, what happens is if we chew? I mean, we have upper teeth and lower teeth. Which ones move?
Lower.
The lower. You would be surprised how many people say both of them. You see, and I'm always delighted I get that answer because it shows to me what a simple, primitive, archaic function this is. We have done it thousands of times and never bothered to think about it. But if I tell them, put your finger on the outside of your upper tooth and move it, you will see it's only the lower. And then I ask them, what does the tongue do when we chew? What's the function of the tongue? Have you any idea?
to push the food back?
No, that happens when you are through with chewing, because then you swallow. And you see, swallowing and chewing are absolute antagonistic actions, as all muscle groups in the human body are. If you bend your arm, the biceps contracts. If you do stretch your arm, the triceps contract. Every muscle that's used or contracted in swallowing is relaxed in chewing. Swallowing is an act of constriction. You swallow down, you press it down. If you have your dinner tonight, just watch yourself. You will be amazed to see how active the tongue really is. What it does, it pushes food constantly towards the teeth. It mixes food with saliva, and it mixes the chewed and non-chewed part until it becomes a ball of homogeneous soft food which can be swallowed then easily. The difference is if you later on tried your luck with a patient. If they only move the jaw, you hear very monotonous, yum, 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 yum. But if they really go into that game, lum, 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 you hear a weird mixture of sounds that has a strange resemblance to as if you hear somebody speaking. As a matter of fact, if you would try fun and in the presence of somebody without any explanation, he may say, "What did you say?" Like nonsensical speech. This complete lose and ease of it. So we have closed mouth, open mouth. And then we go into the third stage, all in one sequence. After you do it with that open mouth, you continue chewing like that, and while you do that, count slowly from 1 to 10 a few times, as if you forget all your manners, and you speak with the full mouth. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, yeah?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Very good. You see, in giving all these explanations, sometimes I have to tell you, open your mouth better. I said, keep in mind your mouth is a loudspeaker. What the loudspeaker is to a radio or a television. And cultivate that feeling, I let the sound flowing out of my mouth. Now, and let me say this, children pick it up easily. Children know still how to play a game. Actors pick it up beautifully. I've done it with many actors because they are used to that kind of make-believe. My male patients usually have no trouble. With the female patients, ladies, they have very often in the beginning inner resistance to the whole thing. It ain't being done. It's one of the taboos of our civilization. One does not speak with a full mouth. Yeah? And now I come along and tell them. So therefore, I tell them, and I tell you that now too, of course, I have no intention to ask you that should from now on go through the rest of your life talking with a full mouth, speaking like that. Nobody can do that. But it's a necessary way of training a better and easier set of reflexes. I'm sure you remember that story from psychology or otherwise, Pavlov's dog with the bell at the foot, you know. Mm-hmm. In the end, the bell rings. And what is a bell to an animal is to a human being a mental concept, a mental idea. So I said, there's only one problem. The only way to train a reflex is by constant repetition. In other words, if you now go home and do that, don't practice this for 10 minutes in the morning and then forget about it the rest of the day. First of all, after 2 minutes, it becomes like the Tibetan prayer mills, a stupid, boring affair, and you begin to think, what should I cook tonight, or what books do I have to read for the next test? but do it for 1 minute, but often. A minute here and a minute there and a minute here. And I'm a great believer in writing prescriptions here. You know, there's an old story, for instance, in the clinics, hospital clinics, where they have these printed prescriptions, cough medicine for fever and so. It's not effective. A patient has to have a feeling you have sit down, he is an individual, and you write that individual prescription. It's unique, although you have done it 5,000 times in your life, but he has a feeling this is for me. So I take a piece of paper and I write them down 10 to 15 times daily for 1 minute only. 1, chewing with closed mouth and a hum. 2, the same with open mouth. Nyam, 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 very loose and easy, let it flow out of me. And 3, continue like this, while counting slowly from 1 to 10, a few times. 1, 2, 3, 4, 5, 6, 7, 8. Okay, now the patient goes home. You are at home, you are a good girl, and do what I want you to do, and you practice. And I hope you practice when you are alone in a room, because it makes people self-conscious enough as it is. But to do it, don't give performances. It makes you very, very self-conscious. And don't do it at home with your mother or your brothers. You will never be able to live that down. Yeah, you think you're a poor girl that lost her mind. Okay, now you come back for a second session. And of course, I said first, all right, let's go once over the whole thing and show me. And usually you have to correct quite a bit. Either they do it too fast, or the mouth is not properly opened. You correct it. And then, of course, comes the next step. Not always, sometimes you have to spend 2 or 3 sessions to get a proper response, but with most intelligent patients, I get it in after 1 session. I said, all right, you realize, of course, that this is a crazy, outrageous routine. Makes sense only to condition a set of beta reflexes. But of course, what you are paying me for is not to chew, right? You have been able to do that since you are 1 year old. But you pay me because you want help with your voice under ordinary condition. Tomorrow you are called up to face another class as a substitute teacher, and what can I do? So, then I said, all right, now let's go into the next step. By that I mean, you pick up something that can be read. Few lines from a newspaper paragraph, from a newspaper, from a magazine. I have here, I grabbed that when I left my office, highlights, well known to everybody who ever worked in schools. You get it free of charge, and that's why I like it. And let me first show it to you what I have in mind. I read these few lines 3 times in succession. The first time I read it with that same exaggerated chewing that you just did when you did the counting. I speak with a full mouth. I don't like anything pruny, he said, and so he carved 4 giant heads upon a granite mountain. Geologists say that his face is 60 feet from chin to top, with noses 20 feet long, will still be there 500,000 years from now on. And that's fine. Now you read the same thing a second and the third time. Everything remains the same. Slow delivery, opening of the mouth, everything loose. The only difference from the first to the second to the third reading, you use less and less of these exaggerated chewing movements, and more it becomes a mental concept. Pavlov's dog rings the bell. And what is Pavlov's dog to a bell is to a human being a mental concept. So the second time, there's a little bit chewing left. I don't like anything puny, he said, and so he carved 4 giant heads upon a granite mountain. Geologists say the face is 60 feet from top with noses 20 feet long, will still be there 500,000 years from now on. And the third and last time, all that's left is a vague image in your mind, I'm still chewing air. I don't like anything puny, he said. And so he carved 4 giant heads upon a granite mountain. In other words, anybody who would listen to me talking like that, he would say he's in speech, so he exaggerates a little bit. But if I tell them that when I sit in my quiet room with them, but here I have the situation in front of me, if I talk to a group like that and I talk the way I'm doing it right now, I think the most of you will say, well, thank God there's somebody who's easy to understand. In other words, it is the opposite of what I always like to call the all-American mumble. The tendency of too many of us to talk much too fast, but particularly the young people who talk at a breakneck speed and barely move their lips. And it's very hard to understand. It is hard here. You can feel it if you want to talk louder. Now try your luck. Just read first with a full mouth. It's the same line.
I don't like anything puny, he said.
A little bit more chewing, yeah?
And so he carved 4 giant heads upon a granite mountain.
Okay, now read it a second time. Same loudness, slow delivery, and just a little bit chewing.
I don't like anything puny, he said. And so he carved 4 giant heads upon a granite mountain.
And now comes the last time you had been forced to babysit for a couple of kids and they have annoyed you to tears with their noise. You said, sit down. I'm going to read a nice story to you. Yeah?
I don't like anything puny, he said. And so he carved 4 giant heads upon a granite mountain.
How does that feel? Does that feel easy? You see, I have done that with many, many actors. I saw one a year and a half ago, and he had a very talented young man, but great trouble with his voice. And we worked with this approach 5, 6 times. And then he disappeared from sight. And about a month ago, I suddenly get a letter from him. Dear Dr. Brodnitz, I just want you to know that I'm playing the lead in a charming comedy at the Kennedy Center in Washington, and I'm chewing my way through the part. And for the first time in my professional life, 8 performances a week don't bother me at all. And nobody should be any wiser. You know, there was, you are too young probably to remember it, it was about 10 years ago, there was a wonderful play on Broadway based on the book of Job from the Bible. It was called J.B. by Archival McLeish. Very demanding part. The man who played the part, an old patient of mine, Pat Hingle, was extremely successful. And after the play was running for 7, 8 weeks, he suddenly had a terrible accident. He fell down unprotected. Elevator shaft broke both of his legs. He was out. They got from Hollywood James Staley, who died last year in Hollywood. He had that program, Medical Center, which you may remember on TV. They rehearsed him to death and then started performing. 8 performances was too much for him. He got more and more hoarse, voice cracking up, afraid he would have to give up that part. Somebody mentioned that I may be able to help him, so he came and we worked together. And after months he gave me tickets for the show and my wife came along. And I said to her, you watch him. If you catch that guy chewing, give me a push. Nothing happened during the first act. And then we went backstage, introduced them, and I said, Jimmy, do me a favor. Tell my wife, did you use any chewing during the first act? He said, what are you talking about? I've been chewing from beginning to the end. In other words, it should, as fast as possible, something that fulfills that ideal of producing a maximum volume of sound with a minimum of effort. And if you ask me what does it, first of all, because of the loose opening of the mouth, you increase the resonating loudspeaker. In addition to that, the more you, the better you loosen up and open the mouth, the sharper your diction gets. And anybody who has ever talked to a large audience, they knows if you have a good diction, you can, as I do right now, speak in a rather low tone of voice and you will be perfectly understood by the whole audience. In other words, you don't have to talk so loud about it. And then it takes away completely that tendency that too many of us have, most of us, and our patients particularly, the constant hammering away what they call the glottal attack, the glottal stroke. You know, the glottis, the space between the words, hitting the chords together with the vein. It is practically impossible to do that with even a slight degree. Now, those of you who psychologically minded, and I don't know how interested you are in that, I like to give you, just for your choice, a completely different interpretation I got from a very interesting patient years ago, who is a very prominent psychiatrist, chief of a department of psychiatry, talks all the time, had great trouble with his voice. And it worked beautifully with him, this carry over into instinctual behavior. And one day he came and said, "Doctor, you have given me your interpretation in terms of anatomy, vocal physiology, musical instrument. Would you mind if I give you my explanation in psychologic terms?" And then he said, "You know, chewing is an act of aggression. Goes back to those animals that still hunt other animals for food, kill them, tear them apart and eat them up. By giving you, your patients, this mental image, I'm eating you up," he said, "it's a wonderful escape valve for all the hidden tensions and aggressivity and hostility that happens to all of us. All of us who work in speech pathologists, doctors, ministers, we all work in service professions. We deal constantly with people. And it would be a miracle if we would not ever so often run across people where we say, 'You son of a bitch, if you only would get out of here, I can stand the sight of you,' but you have to be very friendly, you have to be smiling. And that builds up a terrific amount of tension. And being the voice a main organ of our profession, it settles very easily around that part of our anatomy. And when I mentioned that years later to a psychologist, professor of psychology, he said, "Doctor, this is even part of our language." He said, "You can say, for instance, you know, last night I was at a party and there was a good friend of yours. Unfortunately, we got into a very nasty argument. But I can assure you of one thing, I chewed him out good," yeah? So, I mean, you can take your choice, whatever you prefer, the anatomical, physiological explanation of that. And let me say one more thing. You may have noticed the absence of one thing. So far, I haven't used the word pitch. You know, if you go around and see what goes on in speech voice therapy, I say sometimes with a bad pun, speech pathologists have too much pitch on their brain. They constantly talk about lowering the pitch, raising the pitch. My good friend Bill Perkins in Los Angeles, who wrote these beautiful books, he has once wrote in one of his books that he feels that the manipulation of pitch is a very risky kind of an enterprise, something that is too much a matter of subjective feeling. And I have made the experience again and again, if you put a patient into that chewing technique, that the voice suddenly assumes a pitch that you have the feeling, that's the way it should sound. So with the exception of special cases like the mutational problem, I think I hardly ever use the word lower your pitch, go down with the pitch. I let the pitch become normal in itself. Thank you very much for your help.
Thank you.
And now I think we have another of your colleagues available. And I want to add one or two more little tricks of imagery. So thank you very much. This is Ronnie Shore, and I'm equally grateful to her to be in that not so easy role of the guinea pig here. You see, I just mentioned pitch, but I use it sometimes in one sense of the word. You know, this chewing business has the advantage, as I pointed out, better opening of the mouth, better use of the normal resonator, and improvement of diction. But at least in the beginning, as long as the patient hasn't had that footing right, because you see, I tell them that, I forgot to mention that when we demonstrated the first things, I use for the 3 stages of chewing: full mouth chewing, less full mouth, and finally just thinking of it. I use 3 terms that are a little silly, but they help the patient to remember what I want him to do. If you go to a restaurant and order steak, they want to know, how do you want yours? Well done, medium rare. So you start out with chewing well done, chewing medium, and finally chewing rare. And then, of course, I encourage my patient and say, do it first for the next few days in this systematic manner. Closed mouth, open mouth counting, chewing well done, chewing medium, chewing rare, and I write that down too. But then you should make an effort to perfect the carryover. By that I mean jump into that last stage called chewing rare, without going through any of these preparations. Try it out on the telephone first. There you will have the least inhibitions. Try it out at home. Now, if you do that, in the beginning you may have the feeling that if you listen to yourself, and our ear, what we have to do is 50% ear training, to make our patients aware what goes on, what can I learn to listen. It sounds a little bit monotonous. If I talk like that and with what I call the slight chewing rare, the voice sounds a little bit monotonous because it misses the impact of the dynamic accents, which are bad for the voice, the glottal stroke. So we have to give our patients something substitute. And we can do that easily if we listen to great actors, great pulpit speakers. And you will see that they all use a great deal of melody, the up and down of the voice. And I tell my patients very often that I'm using this quite often myself to keep in a good trim for public appearances like this. That I read something that can be read with a good bit of feeling. Bible, Shakespeare, poetry. And I read it with a slightly exaggerated sense of melody. Or to use that expression, hem it up. And in order to listen what I'm doing, I use my hand to indicate the rise and fall of the melody by raising and lowering my hand, to make myself aware of what is going on. Just here, in simple, here one of the famous monologues, all the world's a stage and all the men and women merely players. They have their exits and their entrances, and one man in his time plays many parts, his acts being 7 ages. Bum, 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 bum. Yeah? Just recite a little bit of that and make a fool of yourself, as I did in front of the audience, by doing this. It helps active participation of your acoustic sense of it. Yeah? Go right ahead. Okay. All the words.
All the world's a stage.
Good. Good, go ahead.
And all the men and women merely players. They have their exits and their entrances, and one man in his time plays many parts. His acts being 7 ages.
You see,
right.
You have probably, when you do that, an overall feeling of ease. It comes out, I mean, you had to some inhibition here with all these kids looking at you. I don't envy you. I'm used to it and I don't care anymore. But I mean, for you it's hard. But overall, it flows out of you. And then we can, of course, have to bring a little bit breathing into this. Now, I have no time and doesn't in the subject to go into detail about what you have sometimes to do to make people aware what they do. Most people, they raise their shoulders, they expand their chest, and they get stiff here. I mean that old rule, stand straight, chest out, stomach in, and that's the way they breathe. But we want to have the same easy release of it. Minimum, or in terms of an automobile, better mileage. Now in doing that, I use a couple of images. And let me try that with you. It's a little bit risky because you never know what is going to, what the reaction will be. But let's see what we can do there. You see, something is rather funny and slightly stupid. I start out with the open mouth and I play a game, acted out pantomimically. I eat a long imaginary strand of spaghetti. Yum, 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 yum. And while you do that, try for a moment, as hard as it may be, to disconnect your intelligent brain that knows what's going on. But tell me, how does it feel if you do it? Do you have the feeling air pushes out? Or do you have the feeling air flows back in? Can you try it? And then tell me what you feel, yeah? Come on. Yum, 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 yum. Go ahead.
Yum, 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 yum. It does feel as if air is moving in.
Look, you gave just the right answer with the right degree of hesitation, because being an intelligent student, you realized, of course, this is complete nonsense. Of course, whenever we make sound, air has to leave our lungs, drive the vocal cords, become resonant sound, and leave the world. But with this strange feeling, you create a feeling and a mental attitude that is strictly the opposite of what people think and do when they use that word project, which I like so little. Project, you have the feeling, I have to throw it out. And if you do it at home, you will have fun if you do it at home without here all this audience. You will see how long you can go on. You get suddenly a big mileage. I don't know, yum, 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 yum. I can go on and on and on. And then we can go from there to counting and to reading. Now it comes to counting, it gets a little bit too complicated. We cannot perform too many bits of imagery unless we are very strongly motor kinesthetic. So this time, while counting, just pretend to yourself and play that game. Air is something substantial. You shovel air back into your mouth with a trace of that showing. 1, 2, 3, 4, 5, 6, 7. Let's see how far you count before you run out of breath. Yeah?
Okay.
1,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21.
Very good, very good. You will see if you do it at home. You don't need to count the last figures as if you are running fast to catch the last bus before they stop running. Yeah, it's amazing how long one can go on like that. It is just by a mental kind of a concept, the idea of minimum optimum. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, and I could go on in. It is minimum optimum. And then one can do it with reading. And for this purpose, it's always a good idea to pick a little poem. Anything that can be recited, typical, more standard poetry, where you have lines of equal length. In other words, you have a beautiful yardstick to find out how many lines can I read in one breath if I have a normal tone of voice to recite something like that, and or the other way around, if you pick a little poem, what is the minimum number of breaths to do it? Here's a little one, charming one of these old poems of Ogden Nash, The Caterpillar. Can you try it? And if you can do it at the same time, stimulate your fantasy a little bit by letting your feeling air flow. The old Italian singing teachers, they used to say, if you sing well, you drink the sound. They wanted equally to get them away from that over-forceful expenditure of energy.
Okay.
Can you try it? Let's see.
No pauses?
Yeah.
Okay. I find among the poems of Schiller no mention of the caterpillar, nor can I find one anywhere in Petrarch or in Baudelaire. So I sit.
Go ahead.
So I sit in extra session to give my personal impression that caterpillar.
Never mind. Don't you mind? Okay.
That caterpillar, as it's called, is often hairy, seldom bald. It looks as if it never shaves. When it walks in waves. And from
Cradle to the cradle.
and from the cradle to the chrysalis, it's utterly speechless, songless, whistleless.
Let me, not bad at all, but you will see you get better and better with that kind of mental imagery. I find among the poems of Schiller no mention of the caterpillar, nor can I find one anywhere in Petrarch or in Baudelaire, so here I sit in extra session to give my personal impression. The caterpillar, as it's called, is often hairy, seldom bald. It looks as if it never shaves. When as it walks in waves. And from the cradle to the chrysalis, it's utterly speechless, songless, whistleless, yeah? Now, there's no kind of stunt. Now, this is a stunt, of course, to shock the customers. You see,
I'm shocked.
yeah, I know. The idea is only nobody in his right mind would go up and read a single poem of 12 lines in one breath. But by practicing these things and seeing that if you slow yourself down, and if you get a little life and melody in it, and you will not less air available, but more and more as it goes along. You know what I would like to do is just to give you an example of results of treatments like that, just to play a few typical examples of patients who had nothing else done with them but this chewing technique combined with a bit correction of better breathing and all that. I mean, for instance, here's a lady who is typical of what can happen to people. She happens to be a nurse in an operating room of one of our large hospitals and has gotten into terrible tightness of air. In my opinion, from all one I had, purely psychogenic. But being in that operating room, everybody had to go at her. She consulted laryngologists, they put her to a hospital, they did a direct laryngoscopy, they did x-rays, the works. And while that happened, her voice got worse and worse. This is the way she sounded when I saw her.
Started just as a severe sore throat, just went into a hoarseness. It continued this way, and I had it looked at through laryngoscopy, and it stopped for about a week.
Now here that poor woman, after 3 sessions we had
What actually is the cause of the headache attack? As a result of this, the correct diagnosis frequently is not made. This may be due to the patient's inability to tell his story correctly. It may also be due, however, to the lack of information.
Now the next one is another typical category, people who developed small nodules of the vocal cords. This is a lady, you will see from the way she talks, I don't know how many of you read the New Yorker, there's always a special column, the talkative lady, you know. And you ask her one question and she goes on and the sentence never ends. But she had a definite small nodule of the vocal cords.
A few months ago, I simply don't seem to have sufficient breath to hold on to a sentence, and I know that if I think of it and talk properly, I could possibly alleviate to some degree if I speak like that and let all the breath out at once, but this is not the natural condition for me, since I have never had any particular problems. My voice used to be an instrument of great use to me, because I am a lover of any form of...
And now here she is after some time.
One of the most emotional-packed high-pressure campaigns ever witnessed in the United States is nearing its climax. Its aim, government medical care for the aged through increased taxation under the Social Security system. The stakes are staggering. If passed by Congress...
And she has remained like that. I mean, I try always to follow these patients through longer periods of time. And since she has learned her lesson, learned to pace herself, talk with greater ease. Here's a patient who had an operation. He had a polyp removed. And he still had a lot of troubles. That was a couple of weeks after the operation. That is the first one here. I just picked at random a few samples.
The entire procedure went into the hospital on a Sunday afternoon. Remained there until sometime Monday afternoon, at which time they began the preoperative procedures. Gave me an injection to relax me, another one to dry up the mouth secretions, which was so successful that I've never been so dry in my life. If I had to write a letter, then the stamp would have been pinned on. And then...
Now this is the second one, is exactly 3 weeks later.
I'm still working. It involves quite a bit of speaking during the day, particularly on telephones and individual small conferences with 2 or 3 people. Now, the lectures I haven't done yet. I plan to start probably in December. Those would be talks to groups of people on the advice.
And the last one here, again, a very large nodule of the removed from the vocal cords. And first, before the operation, what happened lately to your voice?
Well, as a result of a very bad cough, which lasted about 3 weeks, my voice got really bad, extremely bad hoarseness. I lost it a couple of days, or just was reluctant to use it.
Now, after the operation, now that you had your operation?
I
3
had my
weeks after the
operation on January 22nd.
And how long did you keep voice rest?
I kept the voice rest for 3 weeks.
And how does it feel now?
Well, it feels low, my voice is very low and low.
And now after 4 or 5 sessions,
Your children are not your children. They are the sons and daughters of life's longing for itself. They come through you, but not from you.
look, I just want to stress before I stop here that, of course, I'm not saying that this is the method. No method exists that is good for every case. But I have had the feeling from using it with God knows how many patients, it is a useful technique to hang your painting on like one hangs a painting on a nail. But you have to constantly to improvise, you have to invent things, and you have to leave time enough to go into the psychologic background, gain their confidence, let them talk their problems out, which is at least as possible. In other words, don't just be vocal gymnastic teachers, but be human beings who treat other human beings called patients for trouble that seriously interferes with their social and personal relationships. I just want to stop by saying I have been a very good boy because I'm looking just at my watch and I see I stopped exactly at the time that has been assigned to me. Thank you all very much. Okay, thank you so much. You are very welcome.